Hi, this is Dr. Vikram here. Just now I received a message from someone which was basically a patient asking about different types of PRP. So I thought that instead of just replying to one person, because I keep getting this query again and again, बार बार कोई ना कोई पूछता रहता है, I thought I'll just make a quick video about it. So yes, there are different types of PRPs that we do, and especially the ones that we use in our clinic. So I'll go over them one by one. So first is this. This is a basic citrate tube. Okay, this is a type of PR. This is used in most labs in which there is a citrate solution. What this does is when this is mixed with the blood, and it makes the cells to settle down. And once it is centrifuged, you can see a clear cut cells at the bottom and plasma at the top. This is basically used mostly in the labs to collect blood, to collect the sample for plasma, which is sent for your blood lab reports. Plasma serum देखना है अपना, sorry, they want to see plasma, say creatinine, or your all your biochemistry that is seen in this. This PRP, we do use it sometimes. Mostly, I use this in giving in joints for people who have issues with their joint pains, like knee issues or elbow issues or your shoulder joints. So these sort of issues are solved by this. It is easier to do, and in this, the one of the things is that it just separates the plasma. It doesn't do anything much to this. Okay. Second is this tube. You can see this is a slightly advanced version in which there are two things. You can see there is a small solution over here. There is a small jelly over in this, and the rest of the tube is empty. So in this, we collect about 10 to 12 cc of blood, and once this solution gets mixed into the blood, we centrifuge it. This tube is very good that the jelly, it will come on top of the blood, the cells, and it will keep the cells away from the plasma. And if you, I don't know whether you all can see this or not, but on the side, you can notice that there is something written as blood cells and PP and everything. So there is red blood cells, there is gel, then there is a PPP, and there is a PRP. So there is going to be a platelet poor part of the plasma, and there is going to be a platelet rich plasma. So this PRP, what we give as injections, is the PRP part of the blood. So इसमें तीन parts में blood आएगा. The serum will be in the middle part, and the platelet poor plasma will be on the top. So we have to give only that part which is below the top 1 centimeter. उसके नीचे वाला part is the blood that we have to give. Another benefit of this one is that it has got biotin mixed in it. So this biotin is a vitamin that is normally present, required for your hair growth. So this is injected into the scalp directly. So this plasma along with the biotin goes and gives nutrition directly to the hair. If you take biotin orally, it is absorbed by your nails, it is absorbed by your skin, and then your hair. So you can imagine that if you're taking, say, 100 milligrams of biotin, a very short amount of that or very small amount of that goes actually to your hair. Rest is absorbed by your skin and the nails. But in this, the biotin reaches directly to the hair, and the hair will start to grow much better. So this is one of the PRPs that we use. Now the third one that we have is called a GFC kit, or a growth factor concentrate kit. So SASK, there are different types of this, and the tubes are also different. You can see the tubes are a bit similar to the PRP, the one that I showed earlier, similar to this. It also has a gel, and in this, the difference is that once we add the blood, it has to be kept for some time so that it activates the growth factors, the platelets, to release the growth factors. So in this one, the platelets are injected into the scalp, and there they get activated, and there they release the growth factors. In this, the solution already activates the growth factors, and that is released into the scalp or wherever we are going to inject it. So the benefit of this is that the growth factors are already activated. So literature says that this one will give you a result which is say about 25 to 30% faster than this one. So on an average, say you are requiring say about 6 sessions of this, similar result would come from say about 4 sessions of this. That's what the literature says. Now, my favorite amongst this, well, I'd like to try all of them, but like I said, this one I use mostly for joints and other issues, face PRP or skin PRP. I use this one because this is doesn't have biotin in it, and it is a very straightforward separation of the blood. This one I really like because the biotin in it not only gives a good growth of the hair, but the biotin gives a very boost to the existing hair also. It makes the hair thicker. It makes the hair grow longer. And this I use in people who have resistant cases where the growth factor is required at a much faster rate and the quantity is required is also more. You can see at one time we have to use about 4 of these vials at one time to cover the entire scalp. So that's the difference between the different types of PRPs that we normally use at our clinic. Thank you.